When elective procedures were once again allowed by local officials during the pandemic, medical screening clinics opened for business with new protocols for safety. According to KSAT Communities University Health, the problem is not many people showed up, and now there's a backlog of patients who have fallen behind. Ursula Perry explains why at the top of the list for women is your mammogram.
Hi, guys. Hello. Are we ready for this?
It's been more than 2 years since I had a mammogram. No biggie? Not according to new statistics from University Health that show a nearly 89% drop during the pandemic.
If you remove everything above the waist, opening part of the gown will be to the front.
Fewer screens means fewer biopsies, means fewer breast cancers diagnosed.
30% of the time we diagnose a cancer. So if we're not biopsying, we're not diagnosing cancers. And so we know that that number will be lower.
For me, making an appointment at the mobile unit near my office is a great option. And once inside, measures are taken to make sure everyone is safe.
Extra cleaning and more space between patients and more time to position so you don't have to be quite as close. We feel like we've got a very safe environment and people need to be coming back in.
These mobile units will see about 20 people per day, and they want to see 20 people a day because so many have missed out over the last few months.
My mammogram screens appear clean today, a big relief after such a long break from medical attention. For too many others, though, researchers fear that will not be the case.
We don't know yet exactly what impact that's going to have on stage of disease, and nobody's published that yet.
For more information on how you can book an appointment for a mammogram, go to our website, ksat.com, and look for this KSAT community story. Ursula Perry, KSAT 12 News.